All right, welcome everybody. We're going to get started here. So, this next session, we have Dr. Amir Alakam. Dr. Amir Alakam is the Master Public Health Program Director and Associate Professor at UTC's Department of Health and Human Performance. Dr. Alakam has over 6 years of clinical experience as a medical doctor in family medicine and general surgery, and about 8 years of teaching and research experience in nutrition and public health. He holds a PhD in nutrition and food systems from the University of Southern Mississippi, an MS in nutrition and dietetics from the Marywood University in Pennsylvania, and an MPCHB in medicine and general surgery from the University of Baghdad. He is also a Fulbright Scholar from 2010 and a registered dietitian nutritionist. His research interests focus on using the concepts of the socio-ecological model to address health and nutrition needs of marginal populations. Dr. Alakam, thank you so much for joining us, and we look forward to your presentation.
Great. Well, thank you so much. Hope everyone is comfortable. I will show you a different perspective for, and I think there is a clicker or something. That's I need. Than the presentation before me. So it's really here I'm focusing on the health part and how is this related to the built environment. So I was probably a couple people will come later, but I want to see, like, in general, how many of you are from Chattanooga? Good. Tennessee. Great. Outside Tennessee. We have 1, 2, great. That's great. So I have actually a couple slides that is specific for Tennessee. You will see the general one is USA, and then we will go a little bit about the data related to Tennessee. I have kind of little data on Hamilton County, also on Chattanooga. So you will see how we are doing in the term of chronic diseases. Did you get the clicker? Okay. So this is actually the learning outcome you see here. So basically, we'll go through the social determinant of health. Then we will talk about what we have related to chronic disease, how we are doing, the health status of United States. We will examine the evidence that focus on the indoor environment and its relation to health and the quality of life. And hopefully, we will end with a strategy how to examine this in details and in a way that will benefit the built environment. So social determinant of health. So basically, this is the definition of social determinant of health. And you can see it is basically the condition in the environment where people are born, live, learn, work, play, whatever they do that affect wide range of health, functioning, and the quality of life, outcomes, and risk. Social determinant of health are associated with the development of chronic disease and well-being, quality of health in general. This is the definition that we have from the United States Health and Human Service. So you can see this is the most updated version of the SDOH. We have 5 domains, and you can see it's access to education, access to healthcare, neighborhood and built environment, economic stability, social community and social and community context. So you can see neighborhood and built environment actually is one of the domain. Under it, there is a lot of things that is related to the neighborhood in general, not just the house that you live in, but anything related to the environment. Before actually, good, thank you. So before that, one of the domain, for example, was food environment or hunger. So that was a different domain, but now they included it in the built environment and all of this, the social and community context, economic stabilities. We will talk about this in details. But this is really to give you an idea. When you see in this picture is, so the individual in the middle. And this is really something very significant because all those factors affect your health and your well-being equally. So built environment have the same effect as the healthcare access, and education have the same effect as others. So when they did this model, think about the other one we have in the before the hierarchy or the pyramids, when we have in the beginning we have the individuals, knowledge, health belief, and then we will go all the way to the policy and the built environment. So this is different now, because we do believe, and we have a very good data that show every single one have the same effect. So built environment will have the same effect that access for insurance. If people don't have health insurance, for example, it will be the same effect. So, oh yeah, probably. Oh. So this is just general idea about what each domains have. So you can see the economic stability have the income, stipend, the medical bills, all of this. Neighborhood and physical environment, which is we call it built environment. This is related to the transportation, housing, walking way, green spaces, all of this. Education related from anything related to the higher education, the degree, if it is free or you need to pay for it. Food is the same thing, how far you are from the food store, community related to the social network, healthcare access, for example, the quality of care, how many providers you have, do you have, is the health coverage is free or you need to pay for it? Is there is a copay? All of this will include in those domain. So today we will focus actually on the environment, the built environment, and or as they call it here before, physical environment. So today the U.S. Department of Health and Human Service define neighborhood and built environment as create a neighborhood and environment that promote health and safety. So this is actually the goal of Healthy People 2030. And if you are not familiar with the Healthy People 2030, basically those are goals that United States come every 10 years, and they will hope we will reach them by that year. So we just launched the 2030 basically last year. And before that, we have 2020. So our goals is to create a neighborhood and environment that promote health and safety. Under those goals, under this goal, there are a lot of objectives. So what do you think? What kind of objective we need to do, or what we hope in order to get neighborhood and environment that promote health? Just think about objective related to the built environment that can promote health. Give me example. Green space. So this is really big general term. I want you to be more specific. So the goal will be big, but the objective, they will be very specific. So think about a goal you want to do now, and you will make your environment and home healthy and safe. What will be the objective? Very single things. Just think about it. That can be objective. Okay. Access to healthy food, yes. So we do have objective under this one related to that specifically. What else? Give me example. Think about building, since you are building people. Clean air, okay. We will have actually something like that. Clean water, so they call it safe to drink water. Yes, we have objective. So those are all great example. Green spaces, I wish we have specific objectives said green spaces, because this will be the next target for us, but there is no objective that said green spaces yet. I will give you examples actually. So those are the real objective under that goal. So we have reduced blood lead levels in children aged 1 to 5 years. So the objectives run, you can see based on the color. So basically some objective we like them to increase, others we like them to decrease. So in this case, actually, we want the number below. But actually, it's reduced. So the target is to make the percentage very low among children that have lead level of high lead level. So the number was 3.31. We kind of stay on the baseline within the last 10 years. Our target is to have the level of lead in children 1.18. So those are kind of the objective. And this is actually really related to the building. Imagine before that, long time ago, how much was the level? And this is something cause even death among children and brain damage. So we are doing good, although we are on the baseline, but we are doing good. Let me give you another example. So an increased trip to work made by mass transit. This is the one every time I see, it just make me, I don't know how I feel about it. Look to the target of the United States. US Department of Health and Human Service, their target is to increase 5.3% of people take mass transit to their work. Okay, so we are at 5. We just want to increase it within 10 years, 0.3. So some of the objective, like think about Europe. Probably their target will be around 60% or 70%. But that's how we are doing. So mass transit, actually, they have a great effect on the environment, carbon emission, and all of those things. And actually, they increase the physical activity level. So that's something that United States try to increase, but really, this is where we are at. So basically, in every 100 person, we only have 5 that use the public transportation, or they call it mass transportation here. Let me give you another example. So reduce asthma death. So this is really green spaces, we will see later, really play a big role here. So our target is actually to make it 8.9 per million individuals who will die due to asthma. So asthma, this is related to the environment, and you can see it's objective by itself because we see a very good relationship between respiratory disease and built environment. Now you have a good idea about objective. One more. So increase the proportion of homes that have an entrance without steps. This is a goal. This is the objective, actually. So that's one of the objectives. Why this is one of the objectives? Because steps actually #1 reason for falling, especially for disabled or senior citizen. So whenever you have less steps, you have less falling. Falling is actually #1 accidental injuries in the US. So this is one of the objective. Our objective actually, the target met. So we are at 53.6, and the goal is still is 53%. After I read this, actually, I went to my neighborhood and I just look around. My house have 3 steps. And I was like, this is interesting. Yeah. So this is one of the objectives of the US today on the built environment. And that's another one, reduce the proportion of adults who have hearing loss due to the noise exposure. So this is also one of the objectives. The objectives goes long, and each of them related, although they are under the built environment, but they are related to they can have more than one domain. So when you see this one, it said DH, which is basically the, I forget. It is, yeah, I forget what is that. It is health. This one is, I don't know. I forget them. But I know one of them was, this one is respiratory disease, RD. So you can see the objective. Each of them, they have like different levels, and then they have different acronym. And they are very specific because when we see that picture before, so that objective might be under 2 domains or 1. So US health status, now we know the social determinant. Let's see how we are doing in general. So 3 in 5 adults in the US have a chronic diseases, which is high. 2 out of the 5, actually, they have more than one. So they have diabetes and obesity, hypertension and diabetes, something like that, which is make it worse. Some of the most chronic diseases that the US faces are heart disease, hypertension, diabetes, and obesity. And this is actually go nowhere within the 20 years. We still see an increase in those chronic diseases. And that's why it's very important to focus on social determinant, because whatever you do in those social determinant, it will reduce the chronic diseases. Cardiovascular disease is the leading cause of death, and cardiovascular disease leads to higher mortality rate than cancer and respiratory disease combined. In fact, within the last 3 years, we have COVID. How many people died from COVID? Still, we have more people died from cardiovascular disease than COVID. So during the last 2 years, cardiovascular disease is still the leading cause of death, even during a pandemic, which is very interesting. Diabetes, look to this one. So how we are doing in diabetes. See this figure, see the trend. So from in 2000 actually, we were about around 10%, and currently we are about 13% of diabetes, total diabetes. Now we did well a little bit on the diagnosis and undiagnosis because of the prevention measure and because of the physical exam, the annual physical exam, but the total number is getting an increase. Obesity. So we are actually, especially in the southern state, about 35% of the individual live with obesity. So this is obesity. If you don't know that, it's a pandemic actually. So that's before even COVID. And especially in the southern state, you can see the red one is the one have number that is above around 35. So all the southern state is really doing not good. And obesity by itself, it's actually also increase the risk of other chronic diseases when you have it. So health status of Tennessee, about 24% of deaths in Tennessee were actually related to cardiovascular disease. In 2020, Tennessee actually passed the national percentage rate of the cardiovascular disease. It was about 11% of individuals have cardiovascular disease. When compared to the rest of the nation, actually, Tennessee is one of the 10 top states who have highest mortality rate due to the all forms of heart disease. And also about 39% of adults in Tennessee have hypertension. So we are not doing well compared to the rest of the US. Look to this one. So this one is actually show you more than 14% of the Tennessee population suffer from diabetes. So on the obesity rate, you can see we have 36.5. If you can read that number, in 1990, the percentage rate was about 12. 12% of the individuals in Tennessee have obesity. Now, 1990, go all the way to 2020. How many years we have? 30 years. How much increased? So, what is the difference? About 25%? So let's project, and I will show you this slides in 2050. All are here. What do you expect?
Is some of that just a matter of age? We have an aging population. Would some of that rise be just attributed to that?
I don't think so. So actually, obesity, this main numbers is coming from the adult, really, and childhood obesity. I think this is specifically for adult, but usually obesity for seniors, we don't actually, after like 65, we don't include them. Because we do encourage a little high level, a little bit above the normal of BMI. So we do encourage, we call it overweight on seniors because we are afraid from malnutrition and underweight. So above 65, usually they don't include them in those percentage.
Heart and diabetes, all of those.
Yes, definitely, correct. Yeah, yeah. So we are not doing well, and probably the number will get increased within the next several years, 10 or 20 years. So this is a very complicated slide, but I do want to show you actually. I took it from one of the documents that the green spaces have. This is really specific to the zip codes in Chattanooga. So what I want to show you is actually in general in relation to the social determinant of health. Also the zip codes inside the city is actually so diverse and different. And when you can look to the Highland Park, for example, look how many people does not have insurance. 21%. So this is actually above the national rate. When you can see all the other things here, and those are highlighted due to the increase in each zip codes. So within the city itself, and hopefully this slide will be shared with you. I don't want to stay too much here because it's actually not clear. You will see like within the city itself and the zip code, we are also have a very great health disparities, and the same things happen when we talk about Mississippi. For example, if you take Delta area from Mississippi, Mississippi will be normal. Here in Chattanooga, actually, we have the same things. So if you take some of the zip codes like Highland Park, actually our rate will be much, much different. So we will be within the nation level or below the nation level, the national level. So I show you the data now. Let's talk a little bit about the built environment. Now you will know what's the health status, you know what's the social determinant of health. Let's dig in a little bit how to change this in the term of built environment. So what is the built environment? The built environment includes all of the physical parts of where humans live and work. It influences on individual habits. A very good example is a sidewalk. So if there's a sidewalk, you can go to by walking, you can go to work or to buy your food. This will increase your physical activity. This will reduce the risk factor of diabetes and all the chronic disease and obesity. The same things if you have access to a food store, a grocery store. This is actually will increase your likelihood to have more fruits and vegetable intake. If you don't have access to grocery store, then this may affect your hunger. This may actually increase your eating habit of convenient food, and this will increase the risk of obesity and cardiovascular disease. So there is a lot of example. They are actually all under the built environment and neighborhood. So aspects of built environment include land use, walkability, noise, sources, the design of the houses or the building. This include dining spaces. There's actually a lot of study that shows if the dining space is very accessible and easy to use, this will increase the intake of fruits and vegetables or the meals that done at home. So this is something really related to the design. Environmental hazards like chemical, radiology, operation and maintenance, cleaning, pest management, and so on. So this is all under the built environment. Indoor building structure, and this is actually something I was trying to focus on, but we don't have a lot of data. So indoor building structure is really, I want to focus on the houses and home, not just work. Humans spend about 90% of times indoor. So this is something we really need to improve because that's where all our time is. We spend all our time there. Building impact human health on two ways. So we have direct way and indirect way. The direct way is actually affect through impact on people within their four walls. So can you give me example about the direct effect? Yes, that's a very good example. How about the indirect effect? Any taker? Air quality outside, yeah. So that will be the direct effect. So indirect effects, really we are talking about how the buildings will affect the environment. Yeah, energy consumption, this is a very good example. So this is actually the indirect effect on the human health because of your building. So those have two different effects that we need to examine in order to see how the buildings, the indoor buildings, affect the health. So the quality of home influences the health of a population. Many epidemiological studies have described association between poor housing and health. For example, air quality can be 5 times worse in concentration than outdoor air. So this is actually a lot of study that examine air quality, and you will see we know a lot about respiratory diseases and the air quality because that's what most of the study examined. The existence of mold mice chemicals play a part in the indoor air quality of homes and have led to an increase in asthma and respiratory infections. Children that live within an overcrowded environment have been shown mental strain and more respiratory infection and infectious diseases. And actually also showed mental disorders. So we have a couple of the studies show that. And I don't think this is something new. So smoking and improper ventilation aid to in health disparities associated with housing. Exposure to lead can cause permanent brain damage. And without sufficient plumbing, house members are at risk for waterborne diseases like E. coli and Giardia. So also all those are documented. We have a lot of study that documented the E. coli and Giardia in Michigan. So you can see how this affect the health in general. So green homes. This is one of the ways we are trying to solve this issue. So green homes reduce the impact on environment through reduction in the energy use, water usage, and minimizing environment disturbance from the building site. So here we are talking about green homes will have direct and indirect effect on the human health. So it's not just on you as individual, but also on all the population, and that's the indirect effect. So it aims to improve human health through design of healthy indoor environment. So are green homes healthier? Tell me why. Tell me, what do you think? Why is healthier? Few chemicals in the construction, okay. What else? Better air quality, okay. That's energy consumption. All this true. So how is, let's go more specific. What do you think, how the green homes, and when we say healthier, that means if I am living in a green home and someone like me living in non-green home, I will live longer because this is healthier. So how is this happen? Okay. And actually, regardless, this is what's happening because when we show it's 90% of our time, we are spending it at home. Yeah. But we spent a lot more time outdoors when there was no air conditioning. Because it was better outside than inside. Than inside, yes. So it is a correct conception, but this is where I want you to reach the point is when we say, and I'm getting it from the side of health, not from the side of building. When we say healthier, I want to see individual who are at risk of hypertension and another individual who is also at risk of hypertension. One of them I will put them in the green home, the other one I will not put him in the green home, and then I will follow them for 20 years. When I come back, the one who lived in the green home should not have a hypertension because it's healthier, right? So this is the term we use when we say it's healthier or not. Now, I will show you if that's true or not, but this is really the $1 million question now. And that's what we need to answer. Is it healthier? So, of course I think it's healthier because the air quality is amazing. So, but when it comes to the data and the study, we need to show that. Yes, it have a very nice sunlight, so I do think it will be healthier. But I need to approve it, and that's what the evidence need to show on the studies, yes?
So I know like gasoline and diesel can affect your cardiovascular health.
Yes.
So all these toxins in buildings, it does the same thing. It affects inflammation.
Exactly, they do the same things, yes. You are correct. So all of this probably, yes, all of this is when we say that big term, and that's why I'm trying to answer this, when we say healthier, we need to include all of this. But in the real life, you cannot do that because when I say healthier, I need to relate it to one of the conditions. So, in the term, like, for example, I think you are familiar with the blue zones. So blue zones, for example, yes, they will create a healthier environment, but you cannot count it all as a healthier in the term of all the diseases and everything. But when I show you those data, imagine how is the numbers is high. Like we are at 36% of obesity. If green homes will reduce the obesity by 1% or 2%, I will take it. The same thing happened when, for example, think about COVID and the vaccine. It's the same thing. So those percentage and those domain, no matter how much they reduce, you should take them because that's how all the domain will work together. So if I have a healthy environment, if I have green homes, all of them in total, they will give you a great percent to reduce the risk factor of the chronic disease. But let me show you some data, and then probably you will understand more. So there is a lot of study done on the green homes and the homes that have LEED certification. So especially the studies done in the term of work environment. A little bit study done on the house, but more on the work environment. So instead of going through each study, I will just tell you the summary of the finding. So this is some of them. In general, for this purpose of presentation, we actually examine around 33 studies to see if there is any relationship. And you can see some of them actually outside United States. And this is when it say global, actually they take about 4 countries, 5 countries, including Brazil, Taiwan, United States, UK, and so on. So here are some of the findings. Significant decrease in the respiratory symptom and asthma symptom after moving into the LEED platinum certified complex. So that was a clear cut from one of the study. That's what they find, and it was significant. Another study indicating insulating existing houses lead to a significantly warmer, drier indoor environment. And this resulted in improved days of school and work, fewer visits to general practitioner, and hospital admission due to respiratory condition. So this was also a significant finding. Several studies indicated that poor indoor air quality could increase mortality and hospital admission up to 3 to 4%. And this is actually a big percentage we are talking about. Careful selection of indoor building material and design improves indoor air quality and health. That was actually several studies find that. Another study suggested that for every dollar saved in LEED certified building, another 0.77 in climate and health damage are also prevented. This is actually even count how much health insurance they will spend and how much the hospital will spend on the individuals due to the respiratory diseases. So those are the summary of the findings so far. So what we know after we did this summary. So green building may positively affect human health. Moving to LEED green building has shown to improve indoor environment quality, reduce work-related absence due to asthma, respiratory allergies, depression, and stress-related condition. And actually, I will stop here for this one. So I didn't find any study that relate the green homes to chronic diseases that is not related to respiratory or mental health. So we don't have data that examine, well, if I move to greenhouses, will I have less risk of heart attack? I don't know. So we have impression that it will do that. But in order to put it on the study and said, yes, if you live there, you will have less chance to be obese or less chance to be hypertensive. We are not there yet. We don't have study that examine that. What we do know, yes, living in LEED certified homes and green homes will improve your respiratory health. That's it. It's very clear. It will improve your mental health, whether this is a workplace or home. So this is where we are at, and actually it makes sense it will increase if I live in the green homes or green environment or safe environment, my physical activity level will increase. We do have data on that. But then how this will affect the risk factor to heart attack, we don't have data, so it's stopped there. So what should we do? So we know now, we know it's social determinant of health, we know the chronic diseases, and we need to take the next step. So basically, when we talk about evidence, and if you want to make it a healthier, we need to know if this thing is healthier. We need to go to studies that said randomized controlled trial or cohort studies. So what is this basically? Basically, I will examine two groups that one of them will live in a non-green home and the other one will live in the green homes. I can't do it actually backwards, so I will just go to them and measure their risk factor, or I do it perfectly, which is a randomized control trial. So I will take that group randomly, I will put them to green homes or non-green homes. Let's say I have 40, so I will put 20 there, 20 there, and then I will follow them for 1 to 2 years. And I will measure their hypertension, all body mass index and all of this, and then at the end of that I will see if we have effect or not. Now, this is how we do it for all other things, but in order to do that, you also need to be specific about the indicators. So when I say green homes and I put them in the green homes, I also need to measure one thing specifically. For example, the relationship between air quality and hypertension. So I cannot just take the certification all and say this is how it will affect the health. So it is achievable. I know it will be expensive, but there is actually a lot of grants in other countries. They are doing this. And after doing this study on the literature review, I am actually very kind of certain that we will find a significant result, especially when it comes to the hypertension and the heart attack. I'm not sure about the obesity level yet, but I think if we do a study like that, probably we'll find a very good outcome that show us green homes is healthier. You know, in 2000, the World Health Organization, they made one of the access to a healthy indoor environment is a human right. This is actually, they declared that in 2000. So we should all have a healthy indoor environment, not just outdoor.